Dr. Mehmood Butt, and I'm a British-trained and certified consultant interventional cardiologist and director of cardiac catheterization laboratory at King's College Hospital in Dubai.
The prevalence and incidence has been quoted by the World Health Organization, and they have found that in spite of all the efforts that all the countries are making, this problem is getting worse, and more people are in need of having their heart health looked at. Do we need to have a suspicion on everyone? Do we need to test everyone? Who needs testing? The checking of the heart, the checkup of the heart, is a fairly simple procedure. So most of the time we do an ECG, which is basically some wires connected to your chest, and take a snapshot of how your heart's working. ECG is usually normal if you're not going through an active pain and if you're not really having angina or a heart attack. A normal ECG does not necessarily mean that you don't have a heart problem. The next thing is the cardiologist usually take a detailed history and account of how you've been and what your cardiovascular risk profile is. And then based on that, they decide whether they want to proceed to do further tests. Usually the tests are an echo, which is an ultrasound scan of your heart, and a treadmill test, which is an exercise test. That both are non-invasive tests. The ultrasound scan is a simple ultrasound that we do for the pregnant ladies to see the babies. But in this instance, it would be for the heart. It basically looks at the structure of the heart, the valves, the blood flow, and how your heart muscles are, and if there's any blockages, so on and so forth. The treadmill test, which is an exercise test, you walk on the machine with the ECG attached. We put your heart under pressure in terms of physical exercise and see if your heart crumbles. And if there are ECG changes or you develop chest pains and that's a suspicion, then there's a strong likelihood that you might have a coronary artery disease, and that needs to be investigated further. However, if these two tests are normal, which means that your heart is structurally and functionally normal, then of course that's where it ends. That means that in all the practical purposes, your heart is as healthy as it could be. If you have multiple risk factors and your tests are normal, it's usually good practice. You have your heart checked with the echo and an exercise test once a year, and perhaps keep yourself updated. If somebody is found to have a problem in one or both of these tests, then we usually suggest that they should go for a CT scan of the heart or an angiogram, depending on how your symptom profile is and the whole combination of your risk factors and the test outcome.